What's up, guys, and welcome to Behind the Hawks.
Today we're here with Health Assisting. If you guys can please introduce yourselves.
I'm Molly Field.
I'm Ava Brenneman.
Basically, the run-through of this podcast, we're just going to be asking you guys some questions, and you guys will have an opportunity to ask us questions so we can get to know each other more and see a view into each other's shops.
The first question is, how do healthcare workers communicate trust?
I think healthcare workers communicate trust, in the sense that, a care team, you rely on, your other nurses and, other people in the care team. You can't do it by yourself because there's a lot of different, roles in health, the CNA, the actual NA, and you kind of have to, rely on each other, and, it's like a puzzle, and, you all are, a piece.
I think that consistency shows trust, constantly, being there for your, team, your care team, and your patients. I think that shows trust within your workplace.
As you said, there's, a bunch of different roles. What roles are you guys wanting to be in or, trying to graduate with so you guys can go to school and, get that role?
Well, next year we'll get our CNA, so that's certified nursing assistant.
Mm-hmm.
But when I go to college, I want to become a nurse anesthetist, which is it's like an anesthesiologist, but it's a step down. So it's I'll still be a nurse, but I'll put people to sleep and stuff.
I definitely want to become a registered nurse. Like Molly said, we're going to get our CNA, so I want to take the next step and be a registered nurse. So that means you can handle more, and your scope of practice will expand, so you'll be able to do more for your patients.
How do hospitals market without seeming salesy?
Hospitals can market by doing great patient care. I think that in itself shows a lot of that'll give you more confidence to go to the hospital itself, and will give you more confidence in getting help from someone.
Mm-hmm. I agree with that. I don't know how to answer this one.
What personal qualities matter most to you guys?
Trust and empathy, because you have to kind of put yourself into the patient's shoes, because right now we're learning pericare, which is very up close and personal, and you have to understand that they don't want to be doing it either, and you just have to be empathetic and realize that they can't do it themselves, so you have to be there and help them do it.
Yeah, like Molly said, I definitely think that you have to be empathetic, because there's a lot of different situations you'll come across and people with different backgrounds and different problems. And so I think definitely you have to treat each patient as you would a family member. So I think that goes a lot into it. And then responsibility, because not only are you caring for this person, you're being there for them all the time.
Life is
Yeah, it's a lot of responsibility, definitely.
And for their family too,
Yeah.
It's a lot on a family if something happens to someone they love, so you kind of have to be there for their family too.
Okay. Yeah. So how does professionalism affect patients, the patient's comfort?
I think being professional affects the patient's comfort by a lot, because if you're laughing when you see something on their body, or if they throw up on you or get bodily fluids on you and you start laughing or make a gross face, that's obviously going to make them feel uncomfortable and not want to go back to the hospital or the place you work at. But if you're calm with it and just act normal and make them feel comfortable, they're going to want to be there and want your help.
Yeah, like Molly said, at one point they were able to do everything themselves, and now they have to fully rely on someone, and honestly, I would not like that personally. So I think being professional and showing professionalism really gives them the trust and the dignity that they once had.
What made you choose health assisting when you came into the school, and what did you think it was versus what you know it was like?
Well, I just really like helping people, and I just put myself in their shoes, and it's so hard having to rely on other people, and I want to be there for them and make their lives easier. And I thought that health assisting was kind of it's a lot with old people. That's kind of what we're learning most right now, and I didn't know that going in. I thought it was more emergencies and what you would think a doctor would do, but I feel we study more dementia and the second half people's lives and care for that type of people.
When I think of health assisting, I think that you guys do stuff that they do in Grey's Anatomy,
Mm-hmm.
Those surgeries and all that. But then at the end of the day, like you said, there's way more towards that, and a lot of shows they don't show the older side of it.
Yeah.
They show the little kids, kids in their teens and middle age. What about you, Ava?
The reason I picked it was because I always liked the idea of helping someone, or I always like seeing doctors and shows and action and everything like that. So it's just really cool to see. And I picked health assisting because I thought that that would like give me the biggest advantage so I could go like straight into college or help someone like straight out of school. I thought it was like Molly did, like the younger side of the population. Like we have one of our teachers, she did mother baby, so this is also like a big new like thing for her. But we definitely do a lot of like activities of the daily living, so like feeding, bathing, helping them get up in the morning. So like that's a lot different than like helping someone like with deliver a baby.
Yeah.
It's like I wasn't expecting it to be like helping old people like or the elderly population get out of like bed and things like that.
Was health like your guys' first pick? Or like did you know you were coming in as Essex Tech for health?
Well, when I was in middle school, I wanted cosmetology, but I really didn't like it when I explored it because it was too much like on my feet, and I'm not good at doing hair. But but then once I explored health, and I always knew I wanted to do something like that would help people, like in cosmetology, like make people feel better about themselves or like help people. Like I wanted to do a service job, but when I explored health, like I really just like loved the idea of like helping people like medically and stuff. And so then it was my first choice shop, like, after I explored it.
Yeah, Explore was definitely tough because I fell in love with every single shop. And I fell in love with all the teachers and everything. But health assisting was always my first pick because I just liked the idea of helping people. And the teachers and everything is really great. So yeah, I feel like that also helped me to decide.
Next question is, what skill that you've learned so far has made you feel like a healthcare worker?
I mean, I think all of the skills we've learned make me feel like a healthcare worker. We've learned hand washing was our first skill because it's like the most simple. We learned bed bath. We learned, right now we're learning pericare, which is like cleaning like private parts. We've learned like hand washing, like for the actual like patient. Foot care. We've learned nail care for them. Teeth, oral care, right? But I think like the one that makes me feel most like a healthcare like worker is probably either ambulation, which is like when you transfer them, like you help them stand up out of bed and then you transfer them to a wheelchair, or like bed bath, because I feel like those, like both of those things, like I'll actually be doing when I go like to co-op.
The thing that made me feel most like a healthcare worker was we learned how to dress people in bed. So they don't have to like get up and they had an affected side. So either their right side or their left side wasn't working. And bed bath also, that was a big one because it teaches you how to wash people in bed when they can't get out of bed.
What's something that someone can be surprised about that you guys learn in health assisting?
I feel like something that is surprising to people that aren't in health assisting is maybe like probably how much we work with like older people, because like we really didn't learn anything about like pediatrics like at all. We're like basically our whole focus is on people like 65 or older, which I feel like is surprising.
I know you guys talking, I'm thinking that you guys are like working at like a nursery home.
Yeah, I feel like something that would be like shocking is we learn like a lot of like med terms, which it's a lot. We like get tested on them every week.
We have 25 a week.
Yeah.
This week we have 50.
Yeah.
Wow.
We did 2 tests this week for 50. But I think one of the biggest things is they don't realize how much like hands-on and like personal care we're doing. Like it's a lot of trust that you have to build, and it's just a lot of like hands-on care.
And when you guys like do these like procedures, you guys do them on like mannequins or like on each other?
So for all skills except for skills that like we're like touching like private parts, they're on like our friends usually, except for like pericare, that's all on like mannequins.
Yeah, we do a lot of work on each other because it also like it teaches you like how to work with people, and it's not just like a mannequin. But the mannequin, they're almost lifelike. Like they're kind of scary.
We have like one mannequin that can breathe and like
And like make vomiting noises and things like that.
coughing
Like
sounds, like it could like die and you could have to do like CPR to it. So we have like real life like simulation like mannequins.
That is so cool.
Like you guys just said that you guys work on each other. That means there has to be like a lot of trust, right? And like you guys need to feel comfortable with each other. So like how would you say that your guys' shop is like a family, or like you guys connect really well, or no?
I would say yes, but our shop has a lot of big personalities, and so obviously there can be like some clashing. But honestly, our shop is like a big family. Like we all love our teachers. Like we love each other. Like we may like bicker, but Honestly, it is like a family, and at the end of the day, I know that like I can trust all of them with anything, and they can trust me.
I agree. I also feel like, especially like with the teachers, like I feel like we have like real relationships with them, and it's not just like a teacher bond. It's like a real like bond, because when you're working like that closely, like with someone, like you kind of have to be like that. So
What is one myth in the healthcare jobs that you'd like to clear up?
I feel like one myth is like that it's easy, and that it's not a lot on like the nurse or on the person like working, because you're on your feet all day. Like you have to watch people be sick. You have to like watch families cry because their loved ones are sick. We learn a lot about like dementia, which is like really hard to learn about too. So I feel like it's a lot also on like the nurse, which I feel like a lot of people don't realize, and that's like not necessarily a myth, but it's just something that like goes like unrecognized almost.
I agree with what Molly said, but definitely is like it doesn't like one myth is like it doesn't take an emotional impact on the nurse, because like at the end of the day, like I know how much I care about my friends. I can only imagine how much I'll like care on like an older person that I take care of every day. So like obviously, if God forbid anything were to happen to, like the person I was taking care of, then like that obviously would take a toll on me, and I feel like we obviously can't show to the family that that takes a toll on us, but it does.
You could work in any healthcare setting in the future, like where would it be and why?
If I could work in any healthcare setting in the future, I think like I don't really know exactly where I want to go when I'm like older and have like a full-time job.
We
But
could say for like co-op.
yeah,
Yeah.
for co-op, I really want to go to Beverly Hospital just because it's like right near my house, and my aunt works there too, and I always like have looked up to her, and I just feel like it's like a good like environment and a good hospital to like be at and get like experience before I go like out for a full-time job.
Yeah, I always go to the Beverly hospitals.
I would definitely want to like for co-op we have someone on the baby floor at Mass General. I would definitely want to go there. I love kids. Like I get along very good with like kids. But honestly, I would just really like a hospital setting.
What advice would you give a freshman thinking about joining health assisting?
If I could give like advice to a freshman thinking about joining health assisting, I would say definitely do it. Like I know a lot of people struggle with it because it's very like it's a lot of work. Like it's really hard, but it's so worth it in the end. And like even though we're not there yet, like I think like all of us can see that like it's gonna be so like rewarding when we get to like help people and like see people like see families happy when like their loved ones getting taken care of, and like yeah.
I would definitely give them the advice of it's not always going to be easy. Like it changes every single day, like from the work we do. And I know like seeing the juniors like finally getting their CNA license and how excited like they are to pass, it really is like it's all like Molly said, it's all like worth it at the end of it all. And it's just like it's a lot of work and commitment, and it's you build relationships with like not only like your patients but like with the people you work with, because it's like a big family, honestly.
As you guys were just saying, that's a lot of work and stuff. Do you guys know, like, for the roles that you guys want to play, how much schooling you guys would have to do?
So I want to be, like I said earlier, like either a nurse, anesthetist, or an anesthesiologist, and it's like 10 to 12 years of college, but kind of like obviously that's a bigger scale, but it's kind of the same thing where it's like it's going to be so worth it in the end, like being able to help people. And like me personally, like I've had 2 surgeries, and like being like put to sleep is like the scariest part for me, and like it's always just like so scary to me, and like being able to like help people with that, like it would just be like rewarding in the end.
I would want to be a pediatric nurse, so a registered nurse. So that's, I think, 5 years of schooling. It's nothing crazy, but I would probably want to go for my master's in nursing. One of our teachers, Miss O, she actually has hers, and it was really great to like, because we got to see her like going through the process of getting it, and it was very like rewarding for her to get that.
Yeah.
It's a very big like step in the medical field.
If you had to describe health assisting in one word, what word would it be?
Commitment.
Trustworthy.
What's the best part of being hands-on in this shop instead of it just being all, like, textbook and, like, workbook stuff type of stuff?
I think for me, like hands-on is like my learning style. Like I don't learn well like
Yeah, me
sitting
too.
down like with a textbook or like on a computer. So I think it just like it's very like accommodating to like I think most of our learning styles in the shop. Like it's good for people that like learn like that, and I think it makes it easier to like understand what we're doing, because it's like you get to demonstrate it.
Yeah, and definitely where we're like going out on co-op and clinical where we're actually going to be taking care of people, it's definitely easier to start doing it on each other than like reading about it in a textbook, because you don't, like, none of us know how it's going to be at clinical. And I think that this makes it just a little bit like easier to go in there and like at least know what we're doing and be sure like
a little bit of muscle memory.
yeah, it's definitely like it makes us more confident in our skills doing it on each other instead of just like reading about it.
Like would you guys like graduate with a CNA? I just said, yeah. Do you guys get like CPR certified too?
Yeah, we get dementia certified, which we're actually working on right now. We have to have 30 hours of dementia, I think. We get OSHA certified, which every shop does, CPR certified, and then our CNA license.
Have you guys taken any field trips this year?
Definitely one of our favorite ones is we went to an elementary school for like Christmas time, and we read books to them. We did like a bunch of arts and crafts with them. So that was like a good like change of things. Instead of like learning about the elderly population, we got to actually go and hang out with like a bunch of kids and do stuff with them, teach them about germs and everything. Yeah. And then I think that was our oh my goodness. And then we did the Topsfield Fair, which we had to like collect people and like kids and everything. And we brought them into our booth. We showed them about like CPR and germs and things like that. We actually had a whole group chanting CPR on the way back to the thing. It was fun.
We had like a little like baby doll that had like you could do CPR on it, and we would teach like the kids like walking by how to do CPR. And we have like glow germs, which is like you like put this like powder on your hands and then you like rub it together and then you can see all your germs. And then we'd show them like how to get all their germs off, which was cool, and I think they liked that.
Was a field trips your favorite memory? If not, what is your favorite memory?
Favorite memory in health assisting is definitely like getting to know everyone, because like we said, like you work so closely with everyone. The day before Christmas break was really fun too, because we like had hot chocolate, and it was like kind of like a bonding experience, like to get to know everyone in our shop better, which I feel like is very important when you're working that closely.
Yeah, it's definitely like always good to like do things with our teachers and like our friends and everything, but my favorite memory would have to just be like sitting in shop with like my friends. Like we'll like be laughing and giggling over like the skills we're doing on each other. Like one day we shaved each other's legs. Those razors were not very good. I'm trying to think. Yeah, definitely like the hot cocoa before Christmas break. That was good. I feel like there's just a lot.
Yeah.
This is kind of like a tough question, but if our shop, Marketing 565, could help you guys, what could we do?
If marketing could help our shop, it would be maybe like marketing like how we take care of our patients maybe, and like explaining to like the public like how we would take care of who we're caring for and like the process we go to take care of them.
So like market your shop, basically, like.
Yeah.
Yeah, and I feel like there's like market our shop in like a way of like, so there's not like, because honestly when I first like think of healthcare, like I think of like helping people like with bodily fluids, and like other people could think of it that way, but it's so much more than that. So like definitely like market like the caring and like the emotional aspect of it, probably more than the actual like work we're doing.
You guys run us through a day in your lives in your guys' shop.
So when we come to school, we go to gym first period, and then when we get back to the classroom, we put our stuff in our locker, and then we always have a do now, and the do nows are practice questions that we'll take on our CNA exam, and we do that, and then we get split up into usually 2 groups in the morning, and one group usually works on a skill in the lab, and then the other group does like a lecture or like does med terms, and then we do those groups until lunch, and we have second lunch at 11:24. So then we go to lunch, and then we come back and we split up into 3 groups, and then that's usually when we work on dementia or like whatever we're getting certified in like at that moment. So we'll probably do like CPR in the afternoon in like a few months, and like right now we're doing dementia. And then one group does the skill that we're working on in the morning, and then the other group usually does some sort of like lecture or like project, and then we go home.
So do you guys have like theory or no? Or is it like
I think our med terms count as theory. That's like what we call theory.
Yeah, for our theory, we do med term, we do a workbook, so you have to answer questions and then go through it with a textbook. And then I'm trying to think. Our dementia, that was their theory. We learn a segment a day and then we take a test. And then other things for theory are like any projects we do. We also do this new thing, it's called like debate. So we listen to a controversial like healthcare thing. So like a woman went through psychosis after she gave birth. And so it was a big debate on whether she should be tried or if she should be found innocent because it wasn't like fully her choice. And so we did like a big like debate on that, whether if it was right or wrong.
So you guys do like on real life cases?
Yeah.
Okay.
Do you guys have any questions for us?
What do you guys think that we do in our shop, or like what you think healthcare is?
So when I was touring the school, when I walked into your guys' shop, I saw like all the beds and stuff. So then I was like, oh, they're definitely just like putting those, not mummies, what are they called?
Mannequins.
They're definitely just like doing stuff on the mannequins on the bed and stuff. And then like when I went into there for the open house and I saw like the breathing mannequin or whatever, I just thought that I didn't know that you guys did it like with each other. I heard about the shaving the legs thing, but I thought that was just for fun. But you guys talking about it right now, like I always thought that it was just, oh, they're just doing it on mannequins or on textbooks. But you guys saying that you guys do a bunch of hands-on people, like I feel like that's like a way better way to experience it, so you can have like more of an idea of what you really do out there. And like when you go out on co-op, it's not like you're going to be clueless about what you're doing.
Yeah. I kind of what she said, I kind of thought it was just like all textbooks, like textbooks and like I knew that there was like hands-on things because when I walked in there for Explore, I saw that there was a bunch of like hospital beds and it was really set up like a hospital room and stuff. And in clinical, we did like the clinical. Explore. Explore. We did we did it on each other. Like you get like the people and you put them on the wheelchair, and I was like, wow, that's actually really cool and like very hands-on. It was cool. Okay, so as we wrap things up, we have a little gift for you guys.
Yeah, this is a little appreciation.
A little appreciation for letting us interview you guys. There's just a few goodies from our shop. But yeah.
And that's a wrap with Behind the Hawks, same school, new perspective.